More lessons are in the description. If you can master the verbs, you can master the language. Number 1, diagnose. I've been feeling awful lately. Let's run some tests and see what we can diagnose. To identify a disease or condition. Examples: the doctor diagnosed her with pneumonia. It took weeks to diagnose the infection correctly. Number 2, examine. Can you look at my throat? Sure, let me examine it with a light. To inspect a patient or object carefully. Examples: the nurse examined his throat with a flashlight. She examined the patient for signs of dehydration. Number 3, check. Did you check his temperature yet? Yes, it's slightly above normal. To look for signs or problems. Examples: the nurse checked his temperature. Always check your blood pressure regularly. Number 4, detect. Did the scan detect anything unusual? Yes, it detected some minor swelling. To discover or find something hidden. Examples: the machine detected a small tumor. Doctors detected signs of cancer in the scan. Number 5, evaluate. How do you think his recovery is going? We'll evaluate him again tomorrow morning. To judge the quality or condition of something. Examples: the doctor evaluated her recovery progress. We need to evaluate how effective the treatment is. Number 6, assess. How serious does it look? I'll assess the wound before deciding. To examine and make a judgment about something. Examples: the nurse assessed the patient's breathing. They assessed the wound for signs of infection. Number 7, observe. Should we keep him overnight? Yes, we'll observe him just to be safe. To watch carefully for changes. Examples: the nurse observed him overnight. Doctors observed the reaction to the medication. Number 8, analyze. Did the lab finish the tests? They're analyzing the blood samples now. To study something closely to understand it. Examples: the lab analyzed the blood samples. Researchers analyzed the patient's genetic material. Number 9, measure. What's his blood pressure? I'll measure it right now. To find the size, amount, or degree of something. Examples: they measured his blood pressure. Doctors measured the tumor's size. Number 10, test. Do you think it's an allergy? Let's test him to find out. To check something by examination or experiment. Examples: they tested her for COVID-19. The doctor tested the patient's reflexes. Number 11, scan. Is she ready for the MRI? Yes, they're going to scan her brain soon. To use imaging to look inside the body. Examples: they scanned her brain for signs of damage. He had to be scanned before surgery. Number 12, X-ray. Do we need to X-ray his arm? Yes, it looks like a possible fracture. To examine and photograph using X-rays. Examples: the doctor X-rayed the patient's arm. They X-rayed her chest to check for pneumonia. Number 13, treat. Can you treat her right away? Yes, I'll give her the antibiotics now. To care for a patient to heal or relieve symptoms. Examples: the doctor treated her for an infection. He was treated with antibiotics. Number 14, operate. Will they operate today? Yes, the surgery is scheduled for noon. To perform surgery. Examples: the surgeon operated on his knee. They operated early to prevent complications. Number 15, inject. Will the shot hurt? Only a little. I'll inject it slowly. To put medicine into the body with a needle. Examples: the nurse injected the medicine into his arm. He injected insulin before meals. Number 16, administer. Should I give the dose now? Yes, administer it before the meal. To give medicine or treatment to a patient. Examples: the nurse administered the vaccine. Paramedics administered aid to the injured man. Number 17, stitch. Is the wound deep? Yes, we'll need to stitch it up. To close a wound with thread. Examples: the doctor stitched the cut on his hand. They stitched the wound carefully. Number 18, bandage. It's still bleeding a little. Don't worry, I'll bandage it again. To cover a wound with protective material. Examples: the nurse bandaged his arm. They bandaged her foot after surgery. Number 19, perform. Who will perform the procedure? Dr. Allen will handle it. To carry out a task or procedure. Examples: the doctor performed a physical exam. They performed the surgery successfully. Number 20, heal. How's your leg now? It's healing faster than I expected. To become healthy again or make someone healthy. Examples: the wound healed in 2 weeks. Her body healed naturally. Number 21, resuscitate. He stopped breathing. Start CPR and try to resuscitate him. To bring someone back to consciousness or life. Examples: the paramedics resuscitated the patient. They tried to resuscitate him after the heart attack. Number 22, manage. How's she doing with her condition? She manages it well with medication. To handle or control a condition or situation. Examples: he manages his diabetes with daily medication. Doctors managed the patient's pain effectively. Number 23, control. Can he control his breathing yet? Not yet, but it's improving. To regulate or keep something within limits. Examples: the drug helps control blood sugar levels. Doctors are trying to control the infection. Number 24, relieve. My head hurts so much. Take this, it'll relieve the pain. To reduce pain or discomfort. Examples: the medicine relieved her headache. They gave him something to relieve the pain. Number 25, cure. Is there any hope for recovery? Doctors think the treatment will cure him. To make someone free from disease. Examples: the treatment cured her infection. He was cured after months of therapy. Number 26, stabilize. How's the patient doing now? We've stabilized his condition. To make a condition steady or safe. Examples: the doctors stabilized the patient's condition. They worked to stabilize his breathing. Number 27, clean. Should I clean the area first? Yes, always clean before stitching. To remove dirt or bacteria from something. Examples: the nurse cleaned the wound before bandaging it. They cleaned the area with antiseptic. Number 28, prescribe. Can you prescribe something for the pain? Yes, I'll prescribe mild painkillers. To officially recommend or authorize medicine. Examples: the doctor prescribed antibiotics. He prescribed medication for her allergies. Number 29, vaccinate. Have the kids been vaccinated yet? Yes, they were vaccinated last month. To give a vaccine to protect from disease. Examples: they vaccinated the children against measles. You should vaccinate pets once a year. Number 30, prevent. Can this medicine prevent infection? Yes, if taken daily. To stop something from happening. Examples: washing hands helps prevent infection. Vaccines prevent serious diseases. Number 31, take. Can I take your temperature? Sure, go ahead. To measure or collect data or samples. Examples: the nurse took his temperature. She took the patient's blood pressure. Number 32, draw. Will it hurt when you draw blood? Only for a second. To remove blood from the body. Examples: the nurse drew blood from his arm. They drew several samples for analysis. Number 33, explain. Can you explain what's happening? Of course, it's just a mild reaction. To make something clear or easy to understand. Examples: the doctor explained the diagnosis clearly. She explained how to take the medicine. Number 34, reassure. I'm really nervous about this. Don't worry, let me reassure you that everything will be fine. To comfort someone and remove fear or doubt. Examples: the doctor reassured the family. They reassured the patient everything was under control. Number 35, advise. What should I do after surgery? I advise you to rest for a few days. To suggest what someone should do. Examples: the doctor advised him to quit smoking. They advised regular checkups. Number 36, communicate. Did you tell the family yet? Yes, I communicated the results earlier. To share or exchange information. Examples: doctors must communicate clearly with patients. The nurse communicated the changes to the team. Number 37, admit. Do you think he needs to stay? Yes, we should admit him for the night. To accept a patient into a hospital. Examples: they admitted him for observation. She was admitted after the accident. Number 38, discharge. Is she ready to go home? Yes, I'll discharge her now. To release a patient from care. Examples: the doctor discharged her after 2 days. He was discharged with follow up instructions. Number 39, refer. Do I need a specialist for this? Yes, I'll refer you to a cardiologist. To send someone to another specialist or service. Examples: the doctor referred her to a cardiologist. They referred him to physical therapy. Number 40, consult. Should we get another opinion? Yes, let's consult a specialist. To ask for professional advice or information. Examples: the surgeon consulted a neurologist. They consulted experts before the procedure. Number 41, record. Did you write down the readings? Yes, I recorded them in the chart. To write down or document information. Examples: the nurse recorded the patient's temperature. They recorded all vital signs in the chart. Number 42, monitor. How long will we monitor him? For at least 24 hours. To watch or check regularly for changes. Examples: they monitored his heart rate overnight. They monitored the patient for side effects. Number 43, document. Did you note that in the file? Yes, it's documented already. To write official information about something. Examples: the nurse documented every symptom. She documented the patient's recovery process. Number 44, measure. What's his oxygen level? Let me measure it now. To determine size or amount. Examples: they measured oxygen levels in his blood. The nurse measured his heart rate. Number 45, screen. Can we screen the whole class? Yes, we'll screen everyone this afternoon. To check for disease in people without symptoms. Examples: the clinic screened patients for diabetes. They screened all new hires for tuberculosis. Number 46, transplant. Is the donor ready for surgery? Yes, they'll transplant the kidney soon. To move an organ or tissue from one body to another. Examples: the doctors transplanted a new heart successfully. Surgeons worked for hours to transplant the liver. Number 47, sterilize. Should I prepare the tools? Yes, please sterilize them before the surgery. To make something completely free of bacteria. Examples: the nurse sterilized the surgical instruments. They sterilized the area before the operation. Number 48, soothe. Do you have anything for my sore throat? Here, this syrup will soothe it quickly. To calm or relieve pain, irritation, or discomfort. Examples: the lotion soothed her dry skin. They soothed the crying baby with gentle words. Number 49. Apply. Should I use the cream now? Yes, apply it twice a day. To put medicine or pressure on a body part. Examples: the nurse applied the ointment to the burn. He applied pressure to stop the bleeding. Number 50. Sedate. Is she nervous about the procedure? I think so. We'll sedate her before it starts. To give medicine to calm a patient or make them sleep. Examples: the doctor sedated the patient for surgery. They sedated him to reduce pain and anxiety. Congratulations! You just learned 50 important medical verbs. If you liked the video, consider supporting my work and joining the channel. Thank you, channel members, channel subscribers, and private students. And see you in the next lesson.